Our next speaker is Lydmyla Svytlychna. She will tell us about complicated grief. I'm not sure whether she will be telling us about her experience of working with the families of IDPs and veterans. She's been working with them since 2014, but her presentation, I'm sure, will be based on the practice that she's acquired over these years. Can you hear me? Okay. Yeah, you should have stood closer to me. Right, I understand. Good afternoon, ladies and gentlemen, dear friends. The topic of my presentation is when grief goes the wrong way. We came together because we are to discuss this very difficult topic, but despite that, it is still a topic about life. And I will be providing you more information rather than sharing my own experiences. We've heard about lots of practical cases, lots of cases of grief, of bereavement, etc. It's only the second day that we've been working, but my impression is that we've stayed here for at least a week. So when grief goes the wrong way, a complicated grief, methodology of grief therapy, and I will provide you with some information about complicated grief. We know that the process of bereavement can be complicated, and the difference between the usual grief, so to say, and complicated grief is the intensity of this experience and the temporality of this. When a person stays, say, stuck at a certain stage of the bereavement process and in the response to this grief, which brings about this or that form of exaltation. Complicated grief can manifest itself at different stages. The main factors causing pathological manifestations would be the suddenness of loss, the uncertainty of loss, for example, in case of missing persons, the number of losses, this actually overwhelms the grief, then experience of living through the previous losses, additional stress factors, and specifics of the personality of a person who is bereaved. There are several types of complicated grief, chronic or prolonged grief disorder, deferred grief disorder, exaggerated grief response, or concealed grief response. The chronic or prolonged grief disorders are easy to identify and to diagnose. It is about the long response. A person will come to you 3 or 5 years after the tragic event or the loss, and then you see that they cannot recover, and they ask you to bring him or her back to the pre-event situation. So there can be disadaptation and crisis of self-identity. A chronic or prolonged grief response or disorder requires the therapist and the client to address the task the client is complaining about, and the factors that can cause those complaints. Then the intervention should aim or target those tasks or problems. and the person should face the fact that their loved one have gone and would never be back. It is important, particularly when it comes to the missing persons, because a person could not see the body, could not see the fact of death, could not witness the process of burial. So there is a person who can be somewhere and they can return. Then the person has those ambivalent feelings about the deceased. Right, complicated, confused feelings, like the death of a son who committed suicide several years earlier, and then a parent has to first accept the fact that their child killed themselves, and then they have those memories of being pregnant with the child when she was a teenager, and then that destroyed her comfortable life because her family turned her down. And then there could be yearning for a relationship that never was but could have been. And this is particularly prevalent in people who suffered from alcohol addictions or survivors of sexual violence and gender-based violence. Then there's this third grief. These are delayed grief reactions. Sometimes they're also called suppressed or delayed. Then there are factors that delay bereavement. For example, it could be switching attention to immediate needs like children, everyday life pursuits, or chores. Then a ban on the manifestation of emotions, both internal and external, including the stigmatization of open grief and denial of the fact of death. The reason of delayed grief could be multiple losses, loss due to suicide. There was a pregnant woman who lost her family in the car crash. So she lost all of her immediate family, but her relatives told her that she cannot be grieving. She could not be depressed because that will harm her fetus and will be very bad for her unborn child. Then there could be exaggerated grief. A person experiences a particularly intense grief reaction or feels overwhelmed. That is, it feels emotional becoming overload as a result of violation of adaptation. So such responses can arise not only in the case of multiple losses, but even when a person is looking at another bereaved one, or is faced with a certain media event that is focused on a certain loss. When we watch a sad movie or a tragedy in the theater, then it seems okay, but the intensity of feelings might be too intense, too overwhelming. So, and again, the exaggerated or overwhelming grief is when a person feels that the grief is too intense, and then he or she feel incapable of adjusting to this loss. Exaggerated reactions lead to depression, panic attacks, increased anxiety, development of phobias that arise in the context of loss, and the development of addictions, drug or alcohol addiction. For example, a patient lost her father, and then 3 months later she experienced intense fear of death. And sometimes people feel guilty and they say that I am worthy of death as well, or I can die. Unlike the concealed grief, when a person refuses to acknowledge that their bad feelings are related to the death. People with exaggerated grief response know that the symptoms and behaviors they experience are related to the loss, and they seek therapy because their experience is overwhelming or derailing, and they realize that they need assistance. And exaggerated responses also include serious mental disorders that develop after bereavement and often receive a DSM diagnosis. Another troubling disorder that can accompany loss, and unfortunately we encounter that oftentimes, is agoraphobia. That's the fear of being in a situation or in a location where there is no shelter, or when you feel acute anxiety, there might be no assistance.
I'm based in Zaporizhia, and when we have air raids, when buildings are being destroyed, and it's not easy to help people to rescue them, I hear very many complaints about this fear because they saw it firsthand, have rescuers retrieved the bodies, and that is why there's a lot of fear that it will be difficult to extract their bodies after the attack. Another one is disguised grief in disguise. This is unmanifested grief. This is another grief response. Here, clients experience symptoms and behaviors which cause some difficulty to them. However, they are not aware of the fact that these symptoms or behaviors are related to the loss. And if it's difficult for the person to deal with grief in an open way, that could lead to different physical symptoms or blocking of emotions. Another one is depression.